All right, welcome back, good people. As you know, this week's video is going to be on health. I'm going to start each video out with that disclaimer because I think it's very important that we address our health. We need to be conscious of our health, and we need, especially as we get older, right? Because people who are my target audience, my niche group, are what we call baby boomers. These are older people, right? So I'm talking directly to you when I talk about health, because health is more so important as you get older, because you know things don't heal as quickly, or you know a lot of times once you get something it's harder to get rid of it, right? So anything I can do to kind of help, you know, kind of influence you to kind of pay more attention to your health, I'll do that from time to time. But that's not my area of expertise, but I too have to maintain health. So when I share information about different things, I like to also bring some awareness about something you should be aware with or about, right? So having said that, this video I created is going to be 10 issues that people have with their health who are senior citizens, right? Like, I know I'm 60 years old and I'm considered a senior citizen, right? But you know, it is what it is. I think it's a good thing to become a senior citizen. I think it's good to get older, especially if you can maintain your health, you know, your sanity, and you know, your disposition for life, we all going to go down that dark tunnel one day, right? That there's a light on the other side, but no one gets out alive. So, you know, just prepare for that, right? Mentally. Okay, 10 health issues for seniors. Number 1, physical activity and nutrition. Research indicates that staying physically active can help prevent or delay certain diseases, including some cancers, heart diseases, and diabetes, and also relieve depression and improve mood. Now you probably knew that, right? You probably, you know, when you're working out, if you do work out, you probably know you feel better than if you don't work out, right? That's the process. That's how it works. That's the good thing about it. That's the advantage to it, right? That's why people who work out versus people who don't work out, a lot of times the one who don't work out is kind of envious of the person who gets out there and sweats, right? Puts the time in, and they should be. Okay. Number 2, overweight and obesity. Being overweight or obese increases your chances of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, respiratory problems, breast, prostate, and colon cancers. Those are serious issues simply for being overweight or obese. So think about that. You know, I'm not pointing the finger, but you know, when you look in that mirror, you know what you see, right? You know in your mind what you see and what you feel. You have to take action on some things before you see the results you want. Number 3, tobacco. Tobacco is the single greatest preventable cause of illness and premature deaths in the United States. Substance abuse. Substance abuse usually means drug and alcohol. These are 2 areas we don't often associate with seniors, but seniors, like young people, may self-medicate using legal and illegal drugs and alcohol, which can lead to serious health consequences. And we know that, right? All right, number 5, HIV and AIDS. Between 11 and 15% of U.S. AIDS cases occur in seniors over 50. Did you know that? Between 1991 and 1996, AIDS in adults over 50 rose more than twice as fast as in younger adults. Seniors are unlikely to use condoms and have immune systems that naturally weaken with age. That's true. Think about that. Now, I hadn't thought about that, but you know, that's not something I do. Number 6, mental health. Dementia is not part of aging. Dementia can be caused by disease, reaction to medication, vision and hearing problems, infections, nutritional imbalances, diabetes, and renal failure. Wow. Mental health. Number 7, injury and violence. Among seniors, falls are the leading cause of injuries, hospital admissions for trauma, and deaths due to injury. 1 in every 3 seniors ages 65 and older will fall each year. Number 8, environmental quality. Even though pollution affects us all, government studies have indicated that low-income, racial, and ethnic minorities are more likely to live in areas where they face environmental risks. Number 9, immunization. Influenza and pneumonia are among the top 10 causes of death for older adults. Emphasis on influenza vaccinations for seniors has helped. And finally, access to health care. Seniors frequently don't monitor their health as seriously as they should, which means that they're allowing the problem to perpetuate itself and get worse over time. Which, you kind of know your body, right? One of the things about living longer is you kind of feel when things are not right. And you have to take heed to those, because we don't really have a long recovery time. We don't have that long to recover, where, a young person, they heal quicker and they have longer to recover. So just for the longevity purpose, think about, your health. And I'm going to continue making these videos. Again, this week's videos are on health, and I love sharing this information with you guys. Hopefully you learned something from each video, or you can share these videos as we do online. And my new blog is speakwithlarry.blog. Go there, check it out. I got a free copy of my 90-day workbook for you. All you have to do is leave your name and email address, and we're going to start this process, right? All right, I'll see you on the next video. speakwithlarry.com.